We are in the pink month, and then this pink month cannot pass by without we talking about breast cancer. In Ghana, over 4,000 women are diagnosed with breast cancer annually, where almost half of them dies. Studies indicate that 70% of breast cancer patients are mostly diagnosed in its advanced stage. And this is because of lack of awareness, education, and then the superstition we attach to these types of diseases. So, this is the Lab Doctors channel. I will entreat you to subscribe to this channel, like, share, subscribe, and then hit the notification button so that anytime we upload a video, you'll be notified. Let's do this together. So, breast is an accessory organ in a male and in a female. Male breast is slightly different from that of female. With the male breast is made up of ducts, is made up of nipple, it is made up of fatty tissue, but they are in its very less form. This is because a particular hormone that influences a well-developed and then endowed breast called estrogen is very low in men. A female breast is made up of lobules, it is made up of fatty tissue, and made up of ducts, it is made up of nipples, and it is very developed, prominent, and then well endowed. This is because of the influence of a special hormone called estrogen, which is very much in females. A female breast produces breast milk. Breast cancer is the second leading cause of cancer death in women, and also it is the most diagnosed cancer among women. Talking of cancer cells, so cancer cells are cells that divide abnormally and then multiply uncontrollably, destroying other cells. So breast cancer is a breast cells dividing abnormally and multiply uncontrollably, destroying other cells or becoming a tumor. So a tumor is a group of abnormal cells that becomes a lump or a growth. So a tumor can be cancerous or non-cancerous. Other people would refer non-cancerous as a benign. So when you talk of a benign is a non-cancerous lump that is not life-threatening or that cannot spread to other cells or tissues of the body. So 80% of breast cancer are invasive, meaning that they have the ability to spread from the breast to other areas of the body. A malignant tumor is a cancer cell that has the ability to multiply and then spread to other areas. So let's consider the types of breast cancer. So we have the invasive ductal carcinoma. This is a type of breast cancer that starts from your milk ducts and then spread to nearby tissues in your breast. It is the second most common breast cancer. We have the ductal carcinoma in situ. This is also a type of breast cancer that starts from the milk ducts. The difference is that with this particular breast cancer, it does not spread to any part of the body. Yes, it does not spread to any nearby tissue. We have inflammatory breast cancer. This is a type of cancer that looks like a rash on your breast and then it is very rare. Moving on to the next, we have the triple negative breast cancer. It is a type of breast cancer that spread very quickly. Yes, we have the Paget disease of the breast. This is a type of breast cancer that affects the skin of your nipple and it may look like a rash. So these are types of breast cancer, even though we have subtypes, but we are focusing on the main ones. Coming to signs and symptoms of breast cancer. Some people may have signs, others may not, but these are some noticeable signs of breast cancer. There will be change in size, shape, and then color of your breast. Also, a mass or a lump which may feel like a pear, a thickening in your breast or underarm may persist. The skin on your nipple may change color. Also, your skin may look dimpled, scaly, or inflamed. You may experience a blood stain or clear discharge from your nipple. Note that breast has its natural lump and then bumps, which every healthy individual feels with, or healthy female feels with her hand. So one may ask, how do I differentiate a natural lump from a malignant lump? So a natural lump or a normal lump feels very smooth, it feels soft, and then it's able to move from one side to the other. But a malignant lump feels very hard, immobile, and then it has an irregular shape. So we have risk factors of breast cancer. One is age, so 50 years and above. We have sex. Both males and then females do get breast cancer, but females are of higher risk. Family history. If one's parents or close relative have breast cancer, there is a possibility of getting breast cancer. We also have smoking. Tobacco use has been linked to many different types of cancer, including breast cancer. Also, taking beverages that contains a lot of alcohol puts you at a risk of getting breast cancer. Radiation exposure is also another factor. Let's look at how breast cancer is diagnosed. So breast cancer is diagnosed through breast biopsy. That is where a little portion of a lump or a tumor is taken to the laboratory to study to see whether it is normal or it is cancerous. Okay, we have breast ultrasound, we have MIR, we have immunohistochemistry. So these are ways and means that breast cancer can be diagnosed. So the next question is, can breast cancer be treated, or there is a way that it can be prevented? Okay, so talking about treatment or prevention of breast cancer, you first need to know the stage of your breast cancer. So we have stage 0. This is where your breast cancer is not invasive, which means that your cancer cells has not spread to nearby tissues of your breast. We have the stage 1. This is a stage whereby cancer cells has spread to nearby tissues. And then we have stage 2. This is a stage whereby your cancer cells has developed into a tumor, either big or small based on the size. So we have stage 3. This is where cancerous cells has spread to other nearby tissues and then your lymph nodes. And then we have stage 4. This is a stage whereby your cancerous cells has spread to other areas of your body, like your liver, your bone, your brain, and then others. So these are the stages of breast cancer. So these stages will determine what type of treatment will be given to you. So the treatment of breast cancer based on stages are, we have the mastectomy, we have breast restructuring, we have chemotherapy, we also have radiotherapy, and then we have hormone therapy. So these are types of the treatment of breast cancer. So ideally, breast cancer cannot be prevented. However, the risk factors can be reduced. So please make sure you eat healthy, that is healthy diet. Make sure you stay at a healthy weight. Don't forget to exercise. It is very, very important. Do breast screening or mammogram. Another important point. Do self-examination. Kindly do avoid taking beverages that contains alcohol. So these are ways that we can reduce our risks of getting breast cancer. So the next one, we are going to focus on people that have a family history of breast cancer. What are they supposed to do? One, there is a genetic screening So genetic screening will help you to know whether you have specific genes that is responsible for causing breast cancer or that can generate to future breast cancer. We have medications. So we have some medications that are given to reduce your risk of getting breast cancer. Do screenings is very, very important. So the advice I would give is that at least, if possible, go to a health facility, talk to your nurse to do breast screening every quarterly, or better still, you can learn how to do self-examination at home. This will go a long way to help us detect breast cancer early. Breast cancer is real, it does exist. So please let's take good care of ourselves. Just as I always say, your health is very important, not to only you, but to your family, to the country Ghana, and to the whole wide world at large. So stay safe and then stay healthy. Till we meet again. Bye bye.